I often hear folks in groups and on Facebook who have lung disease who will say, I seem to be doing worse, or I seem to be desaturating faster, or various subjective things where they're feeling like they're not doing as well. And my response to that is, an old management adage is, if you can't measure it, you can't manage it. And so while feelings are very important in how we feel when we're doing something, having a way to track actual data is critical. And today we live in a world where we can track data, and it's quite simple and quite inexpensive. We spend inordinate amounts of money on eating out, fast food, things like that. And you can buy for 2 meals out, you can probably buy a tracking device. Like, I use a more expensive one, it's the Apple Watch, but it's not nearly as costly as the copay on some medications that don't do a heck of a lot of good for improving your fitness. So tracking your heart rate, tracking your oxygen saturation, and then using another device like a spirometer. There's a digital spirometer you can buy for $30, which allows you to, on a weekly or regular basis, track your lung function. Why wait until your 6 or 9 or 12-month checkup comes along with your doctor where you're going to do a pulmonary function test? Why wait until then to figure out what your lung volume looks like? You can track lung volume. It's not the same as a DLCO measurement in a hospital or environment, or as the PFT's done in a very structured, rigid environment. But I've seen folks who have good days and bad days on those, where you wait 9 months, you go in for your pulmonary function test, and you had a bad day, or you ate a meal before you went there, or it was early morning and your lungs are not as flexible and strong perhaps at that time of day, so they get a bad test, and now for the next 12 months they're declining, they feel like. So measuring your own activity, measuring your heart rate, that's critical for me. I'm walking on a 2-mile walk with my dogs this morning, and I'm not using oxygen. I use oxygen whenever I do strenuous exertion, but due to my ability to do more without oxygen is because I've done a lot of training with oxygen. I train every day. I exercise strenuously every day for at least a half hour, 45 minutes. And that enables me to do more without oxygen. So oxygen is my superpower, gets me stronger. And then I can track my heart rate and my oxygen saturation when I'm out for a walk and say, well, I think I'm actually improving. Some days I don't feel as good, but if I use that feeling as the measure of how I'm doing and am I declining, that's like riding a roller coaster of emotions. So track your data, heart rate variability, blood oxygen saturation, lung volume using spirometry, things like that. Track it on a regular basis, and then compare that to how you feel. Also track your sleep. What's the quality of sleep you're getting? How many times do you wake up during the night? And what's your resting heart rate? What's your sleeping heart rate? What's your sleeping blood oxygen saturation? All that data is so easy to check, and so you'll have information to give to your pulmonologist or to your physician when you do go in. You can say, look, I've got 6 months of data. This shows I'm doing better, or this shows I'm doing worse. Let's talk about how do we fix this. You're responsible. You're the advocate for your own health. You're not there as a passive participant to show up and say, fix me, doctor. So take an active role in knowing how you're doing and measuring empirical data to know how you're doing.